2 weeks into class, nearly 5,000 Texas public schoolers have already tested positive for COVID-19. Another 3,000 staff and faculty have the coronavirus too.
Because of reporting delays, those numbers are even higher in reality. Good evening, I'm Aaron Wright.
And I'm Sharon Coe. The Delta variant's rapid spread has many of you concerned your child will bring home the virus from school or throw a wrench into your daily routine.
I don't want it to get to the point where my 17 and 12-year-old have to watch my 4-year-old when they need to be learning because everything's shut down. The schools have to close.
That mom has 2 children in the Shirt School District where masks are optional. It's why doctors say parents should have a plan just in case your child comes home with COVID-19.
Eyewitness News reporter Matt Houston explains.
It's a worst-case scenario. Your child who can't get a vaccine catches COVID at school and spreads the virus to someone at home. But parents can plan ahead so that's less likely to happen.
As you do for hurricanes, the best time to prepare is before the storm.
Dr. Juan Ferreira says it all starts with a list.
What are we going to do? How do we separate? What is our action plan? Which parent's going to take over?
He suggests pairing an infected child with an older sibling or parent who's ideally already been exposed. There should be a designated area of the house where they can quarantine, preferably with its own bathroom and access to a window for better circulation.
I've seen families who have sort of hunkered down that way, and some of the family members that are separated don't get sick.
If they have to mingle, family members should mask up in common areas. Ferreira says you should keep the pantry stocked and 2-parent households should split up errands and chores now.
Parents that have kids that are separated in age are very familiar with that tag team approach, right? We're all on the same team, but we can't do everything together, but we're going to get through it together.
Above all, he says parents should make sure everyone who can get the vaccine takes the shot.
So Matt, what advice did the doctor have for kids who've been infected?
Yeah, Aaron, he says they should get outside. You can get more vitamin D from the sun in just 10 to 15 minutes than you can from a multivitamin. That's good for your immune system, especially if you've already been infected. So if your kids are sick and they feel up to it, you should encourage them to spend some time outdoors. I'm Matt Houston, KENS 5 Eyewitness News.